Good afternoon and welcome to the next live session of the 2021 Virtual Wellbeing Conference, part of Connect 2021. My name is Ian Hart and I'm the editor of SHP, and I hope you're all enjoying the content so far. If you've not been able to tune in live for every session so far, don't worry, all of the content will be available on demand within the platform from now until the end of July, and that applies to this session as well. In this session, we're going to hear from Stephen Haynes, Head of Programme for Think, Talk Together. Stephen is a specialist in the design, implementation and management of workplace health and wellbeing programme and the co-founder of C3 Workplace Health Movement, a global networking body of HR and workplace health professionals. Stephen is also a former advisor to the Mayor of London's Healthy Workplace Charter, as well as an assessor of London-based organisations examining and advising on healthy workplace charter standards. In a moment, we're going to hear a pre-recorded presentation from Stephen, and after that, Stephen is going to join us live to answer your questions. So please get those in during the presentation while you watch the film, and we'll try and get through as many as we can at the end of the session. Stephen, over to your presentation.
Hello, I'm Steve Haynes. I'm the Head of Programme for Think, Talk Together, which is the partnership brand of the leading mental health charity Mates in Mind. And we work with around 450 organisations all across the UK and some outside the UK. And we help them optimise mental health at work. And we provide various tools, resources, awareness and skills. We're also a key partner to the British Safety Council. I'm head of programme and I help employers develop and optimise mental health and wellbeing programmes. And much of my work is in helping companies understand their data so that they can take a much more informed approach to developing relevant programmes for their business. In the next 20 to 25 minutes, we are not going to talk about what wellbeing is or what the business benefits are. What we are going to focus on now is the how. We're going to explore a little bit about how the pandemic has accelerated trends. We're going to think about what we're also trying to address when addressing mental health and wellbeing in the workplace, and also explore a little bit about what does good actually look like. We're going to think about what data should we ideally be looking at to inform our approach. How holistic a picture of the well-being of our workforce does our existing data give us? How informed an approach can we take based on the strength of that data? Equally, we'll explore a little bit about what our data isn't telling us and how we can optimize the measures behind what is driving that data. So let's start by putting things into context. If we look at each of the different evidence-based approaches to addressing well-being and mental health at work, they can be broadly summarized into something not too dissimilar to this. Firstly, at the top, assessment. Understand your organization and your people, both from a policy and procedural perspective. What's already in place? How consistently is it applied or adhered to? How relevant is it to your business? What data is currently captured? How robust is that data? And how robust are the measures behind that data as well? And from an employee perspective, how well are your employees? How informed and robust is the information that supports this? Are you looking at single or multiple sources of data? How frequently are you looking at the data? And also, who's analysing the data? At the end of the day, data is going to play a really vital role in any programme design. To ensure the right interventions are put in place, we've got to make sure they're based on credible information. As Chief Medical Officer said back in 2013, Sally Davis, she said, wellbeing interventions shouldn't be carried out without understanding the issues they seek to alleviate. I mean, after all, business leaders don't make key business decisions based on uninformed data, do we? And we know that our people are instrumental to the success of any organisation. So why should the decisions we make around employee well-being be based on anything other than informed data? We also need data to help us understand what we're trying to address. Is this about improving work organization and job design? Is it about promoting healthy work behaviors? If so, what are we addressing? Is it about improving the identification and management of work stress? Optimizing attendance management, rehab and return to work, or some or all of the above? Our data will inform the right intervention and support infrastructure for our business. And when we think about our support infrastructures, we should include our employees and our managers and our leaders, because everybody, not just the helplines, not just the wellbeing interventions or the health-related insurances, play an equally important role in every organization's support infrastructure. And we'll come back to this in a bit. So once you've got the right data, you've optimized the measures behind what drives your data, you're in a much better place to monitor and review your ongoing program, and then align employee well-being to the bottom line. It's also important that you've got the right people doing the right things. So ideally, look to formalizing your program ownership and roles and responsibilities. Ensure senior level ownership engagement. Your business leaders need to have that oversight and be accountable for the well-being of the workforce and the bottom line. A program steering group made up of relevant stakeholders such as HR, health and safety, for example, can play an important role in the design of any program, ideally with one person or function responsible for the stakeholder engagement, the data management, the program design, etc. Someone who's going to collate, analyze multiple data sets so that together with the steering group, you can make informed decisions about your workplace wellbeing program. Employee representative groups or functions who, under the direction of the program lead, can play a key role in capturing views and opinions from the wider workforce and even be involved in the implementation of localized initiatives. Develop and introduce a centralized dashboard that provides you with a much more holistic assessment of all the relevant workplace health-related data outputs. In their paper on what works for health and wellbeing in the workplace last June, the What Works Wellbeing Centre identified numerous activities and programs that could be used in workplaces to improve wellbeing. And it highlighted some of the key things that really matter when it comes to how interventions are implemented, so they achieve what they actually set out to do. For ensuring employees and management are supportive of wellbeing initiatives, to having adaptable, good quality systems in place. It also outlines principles to consider when implementing wellbeing programs, which all make good common sense. These include things like clearly communicated, good coherent programs, commitment from the relevant stakeholders, consistency in approach, and also creativity. And of course, we can't forget the creativity element, can we? Because whilst we need robust data to help us put in place that informed and relevant approach in our business, sometimes good wellbeing initiatives do just happen by accident. And ultimately, the more we know, the more an informed approach we can take. For example, let's say you're going to introduce a psychological first aid model. For example, training a cohort of staff under the 2-day mental health first aid or equivalent course. What gaps will that additional support measure be filling in your business? How will your additional psychological first aid model be integrated within your overall program? What data are you going to record and monitor? If you're going to introduce a financial wellbeing intervention into your business, again, how robust and comprehensive is the data that is informing your decision? And let's think for a moment about where we're ultimately going. If we think about where your business is in your employee wellbeing journey, are you just getting started? Are you developing? Do you have various initiatives in place but limited holistic data to understand real impact? Do you have robust methods of identifying exposures to work stresses? Can you effectively link the well-being of the workforce to the bottom line of the business? I don't yet believe there is a gold standard in workplace well-being because at the end of the day, we're continually learning, aren't we? We're continually developing and continually enhancing our approaches to employee well-being. Yes, there are best practice approaches. Yes, this is a rapidly growing field and science. And I feel I would be remiss to say, here you go, once you reach this point, go no further. It doesn't work that way. And it almost goes without saying, doesn't it? Employers are absolutely spoiled for choice when it comes to health and wellbeing services and benefits. But no matter how extensive a company's suite of employee wellbeing benefits and services are, we're continuing to see more companies question their relevance and their effectiveness. That's not to undermine their value and importance, but it is to get us to consider how relevant the design as a whole is when based on clear, holistic and informed picture of our workforce. And also, are we as organizations getting the right benefit out of each of the services we provide at the moment? One way to think about employee wellbeing design is to break it into primary, secondary and tertiary approaches. Primary interventions to employee wellbeing design focus on work organization and design, the quality and safety of the physical environment, choice architecture, the culture, how workers feel about their work. And primary interventions make it a board issue. Here, we're identifying and addressing the drivers of employee well-being. Secondary interventions focus on upskilling employees and managers, whether it's time management, to stress management, to mindfulness, to resilience. Whilst tertiary interventions are focusing on the point of need, the treatment, the rehabilitation and recovery once things go wrong. And historically, much of the focus in workplace health design has been on the tertiary interventions rather than focusing on the primary areas. And what we're seeing today is an increasing reversing of this dynamic. The focus of workplace well-being today is shifting to the primary and addressing the source. And this is really, really great progress and critical stuff. And we can't ignore that the fact the pandemic has accelerated significant trends in workplace well-being. It's reshaped how we're working and where we're working, and it's having a significant impact on our well-being. Even if we just look at the Institute of Employment Studies Working at Home Wellbeing survey towards the end of last year, around a third of people reported increases in work pressures. Over 40% said they didn't have time to get their work done. Over 40% reported increased levels of fatigue. And in this same study, we've seen increases in musculoskeletal complaints, increased alcohol consumption, less healthy diets, less exercise. Conversely, we've seen greater engagement between employer and the workforce. We're talking more, aren't we? We're talking more about the non-work stuff. How are you doing? The pandemic has accelerated trends exponentially in workplace well-being. One HR director commented to me just a few weeks ago, actually, that getting buy-in for well-being at work was no longer difficult. Now, we're not having to sell the importance of a happy, healthy workforce to our board. It just became their number one priority the day we went into lockdown. And amongst the organizations we work closely with, we've seen increased rates of anxiety, increased financial worries, and of note, more managers being they are not necessarily comfortable in addressing. The vital roles that managers play in worker wellbeing are being tested to the absolute extreme. However, managers don't necessarily understand their roles and responsibilities when it comes to the wellbeing of their people. We also need to think about employee help-seeking behaviours because this plays a crucial part of every workplace wellbeing design, and it's a key determinant in optimizing the measures behind what drives our data. I'll give you an example. So a common question that I'll get is, Steve, how can I increase my employee assistance program usage? But actually, is that the question they really want to ask? is it the right question? Is it more about how can I optimize access to the right support? Just because 1 in 3 of us will struggle with their emotional or mental well-being at any given time doesn't mean a third of your workforce is going to call your employee assistance program. People will reach out to varying means of support. There are also various barriers to support. And I don't mean whether or not an employee sees a helpline post on a notice board, but self-acknowledgement. Do I recognize that I may be struggling? How could talking about my issues actually help? What would happen if I talk to my boss about how I feel? My boss's calendar is always full, or their door always seems to be closed. It never feels like the right time to talk to them. If I did, would they know how to help, etc., etc. Also, would I be able to express myself or my issues appropriately? And when's the right time? Barriers to support and help-seeking behaviours must factor in every ongoing workplace wellbeing program design. It's really, really important. Also, we've got to remember that some people will find it easier to recognise changes and issues in those close to them rather than recognising or acknowledging signs in themselves. We may be more likely to approach people closer to us before reaching out to professional support. And just because that help is available, we can't assume that people will automatically reach out. So just because we have a helpline doesn't mean people will use it. People will reach to different themes, and that's really important to bear in mind. And this really reinforces the vital role that everyone plays in every organisation as part of a workplace wellbeing support infrastructure. Contrary to some approaches to addressing employee wellbeing, externally provided support services are not the front line of employee wellbeing. Your people, your managers, and your leaders are. And importantly, your leaders and managers are right at the very front. They're best placed to create mentally fit and healthy work environments where people can thrive. They'll often be the first to spot and have the opportunity to address issues early in their teams. Their behaviors, their competencies, their competence levels, their attitudes can either add or alleviate stress and well-being. And they are often that very first line of support and a key gateway to referring to the relevant external support services. So let's get back to the data. The more information we have, but importantly, the more holistic a picture we have by looking at multiple data sets, the more informed and relevant our programs are. And this is both about making sure we're looking at all the relevant data holistically, but also ensuring we best optimize of less value. And by optimizing the measures behind what drives our data, we need to look at that support infrastructure. This is about maximizing every opportunity for accessing the right support services at the right time. So knowing and mitigating your barriers to support, as well as minimizing chances of employees falling out of that support. So how can we optimize our support infrastructure and get the most out of the measures behind what's actually driving our data? After all, our data outputs are only ever as good as what we put into them. So I'm going to close on a few examples. Let's take an EAP, for example. So Employee Assistance Program, one of the most effective communication channels for an EAP is not posters, it's co-workers, it's peer support, and it's line management, it's management referrals. So are your staff and managers comfortable starting a conversation, listening, recognizing their boundaries, and ultimately signposting to what, in many cases, will be one of the most common first line of professional supports in a workplace, the Employee Assistance Program? Or if you don't have an Employee Assistance Program, freely available external support services, such as industry services, such as Ben in the construction sector, or the Lighthouse Construction Industry Helpline in the construction sector, for argument's sake. Peer support has a tremendous impact on people engaging in available support services, and that's really, really critical. Employee assistance programs also provide valuable short-term solutions-focused or brief counselling. They are one element of an overall support infrastructure, not the. So in optimizing an EAP model, consideration's got to be given to how each service or support element integrates with each other to ensure as seamless a journey with minimal barriers to entry as possible for employees. Line manager referrals will have a significant benefit on minimizing some of those barriers and maximizing access to support. And when looking at your data outputs, so when you're looking at your utilization of your helpline services, be mindful of what's behind your data. Explore it in more detail. For example, usage referred to things such as requests for general information. Is there more behind this? Are there employees reaching for support that don't feel comfortable or are unable to effectively express themselves and therefore not progressing with the support? Consider the management conversation skills or the conversation management skills of the call handlers. Active listening skills, formulation and support, for example, will have a tremendous influence on the EAP service ability to uncover comorbidities, elicit as informed a picture of an employee's overall mental well-being as possible, and ensure the most appropriate support and or signposting, because remember, this is short-term solutions-focused counselling, so signposting to other supports as well. How does your helpline categorize employee health and well-being at point of entry, so the point someone reaches out to them, ongoing, and of course also at point of exit? How do you know what the distance traveled is for staff using the service? What case management services can be provided? For example, how does your EAP monitor cases ongoing? How are employees signed off or handed off to third parties? How is your EAP integrated with your other services, such as occupational health? Are there additional services readily available through your EAP that you're not using currently? For example, debt and financial guidance, coaching support for managers, legal information. Check what's available and communicate it as appropriately, but making sure it's part of your wider program. Let's look at absence data. So when considering your absence data, think about the inputs and the outputs. How well is your policy known and how consistently is it adhered to? Are managers confident and comfortable in their role and responsibilities in managing absence? Are return to work discussions taking place? If so, how consistently? Are you recording the information centrally and actioning on it? Are stress risk assessments and discussions taking place? If so, when and how consistently? Are managers comfortable in doing them? Are your protocols and procedures for both short and long-term absence applied consistently? Could your current approach influence early identification of issues and minimize barriers to accessing support? What are your trigger point determinants? Are they right for your business? Are they consistently applied? Are managers competent in managing them effectively? Do you have variations in sick pay? Could that negatively influence reporting, recording, or management of your absences? Is there a clear process to support managers in keeping in contact with staff who are absent from work, or clear return to work procedures and guidance? Is your data capture optimal for your company? What do you capture? Who oversees and actions the outputs of that information? Let's close on one final example, your employee data. What, when, and how are you asking? And what are your employees telling you? We've seen a tremendous growth in things such as Pulse or engagement surveys since lockdown, as employers are really keen to strive to get closer to their employees and check in on how they're doing so they can put in place relevant measures. But are we asking the right questions and are we interpreting the results adequately? It's also, remember, our legal duty of care. Employee mental health and well-being is covered in various legislation, which if a business fails to comply with, it could face risk of a tribunal, such as disciplinary discrimination claims, or health and safety issues such as stress claims, or personal injury claims such as psychological injuries, for example. And under the 99 Management of Health and Safety at Work regulations, which just trips off the tongue, employers have a duty of care to assess the risk of stress-related ill health arising from work. The 1974 Health and Safety at Work Act, we've got to take measures to control these identified risks. There are various ways of capturing this information, whether it's one-to-ones, individual stress risk assessments, to site or project risk assessments. Can you design out work stresses from the outset, for example, through to group-wide surveys and focus groups? So critically, when looking at your employee wellbeing data, think about whether your wellbeing assessments are holistic and comprehensive. Are they identifying and measuring the impact of the key drivers of workplace wellbeing? Are you asking questions relating to individual personal well-being? If you are, why and what do you expect to do with that data? Are they designed to enable ease of benchmarking against other existing data sets? And do you have methods in place to be able to explore the themes and outputs of your surveys with employees so you can drill down into particular areas? For example, focus groups or using employee representative groups. Ultimately, robust and holistic data is going to drive an effective workplace wellbeing program. Optimizing our support infrastructures and optimizing the measures behind what is actually driving our data is really vital. Thank you for your time. It's been a pleasure to be joining you today. Thank you.
Welcome back. Very interesting and useful presentation from Stephen there. So Stephen, thank you very much for that. And Stephen now joins us live to answer any of your questions. So please do keep your questions coming in. We've got about 15 minutes to go through some questions. So Stephen, welcome to the conference. Thank you very much for joining us this afternoon.
Thanks, Ian.
First of all, you mentioned during the presentation there about a greater engagement between employers and employees, and getting buy-in now is easier than ever. What do you think is the best way to capitalise now that we kind of have the ear of senior management in order to get initiatives and ideas implemented?
Yeah, I hate to use the word data because I think data has been very overused in the past 25 minutes. A lot of it will come back to making sure that senior leadership have got the right information that's going to help them make right informed decisions. And quite often those questions that we're hearing from senior leadership down through to HR, HSEQ, etc., will tend to be around, how do we best engage? What are the issues on the ground? How are our people? And it's that kind of information which can be really essential in helping inform. So focus groups, one-to-ones, looking at what data you've currently got to begin with, and then effectively almost think of it as going back to the drawing board, looking at your jigsaw piece or puzzle, seeing what pieces of the puzzle you've currently got, knowing what the gaps are. And if that's your start of the 10, take that to the board. Because we know people are struggling, people are thriving. And what we've got to better understand is where are the challenges within our business, so that therefore we can best address them.
One of the things that we've heard, it's a common thread from what I've heard when interviewing people in the profession over the last 12 months or so, and it's really weird, I find, to talk about it as an opportunity, but actually I think, and hopefully you'll agree, that it's actually a really good opportunity for the health and safety profession in general at the moment. And I think the comment from the presentation kind of backs that up, that actually senior board members now rely on health and safety practitioners to operate the business. Without the health and safety manager being on board, you cannot operate your business, you cannot run safely. So actually there is a really good opportunity for those forward-thinking practitioners now to actually utilize that and get those messages out there and actually use that moment now they've got the ear of the board, and actually get some of these ideas out there.
Oh, definitely, yeah. I think just by better engaging with our workforce and asking what needs to be done, what are the challenges on the ground, is probably the most important thing that an organization can do.
And along that theme, obviously communication is a huge part in health and safety and workplace in general. But do you have any tips or tricks for communicating when managing upwards and when dealing with those senior managements in order to get some of these ideas across?
Yeah, I think clearly present the case. What is it you're trying to get across? What are the issues you already see? So almost do that background research internally to identify the gaps and the issues, and then take it forward to the board, which will then get their buy-in. Because ultimately, you want their agreement and buy-in from the outset. And in many cases, there will be that. It's very rare that I come across senior leadership that genuinely sit there and say, we don't care, our primary focus is on bottom line. It just doesn't really work that way. But making sure that they're engaged as early on as possible, and making sure you've got enough information and equipped to do that and to get their buy-in is a really great start.
And would you agree that there's quite a gap between companies that are doing workplace wellbeing well and companies that are not doing quite so well? And if so, how do we bridge that gap in our workplace wellbeing program? If a wellbeing program is still in its infancy in a business?
It's a really interesting question, and yes, we see tremendous gulfs between really bad practice to exceptional practice, and I would still, like I say, I think I'd be remiss to say, we've got to a point where we know what the gold standard looks like, because I don't think that those goalposts are ever moving when it comes to workplace wellbeing. Because when we talk about workplace wellbeing, we're talking about ultimately optimal performance of our people and optimal performances of our business, whilst ensuring we've got the right optimal support in place. And there are significant gaps between one and the other. So industry bodies can be good ways in helping different sectors get into certain levels. Obviously, getting external advice is another great way of understanding actually where do we sit. We have some organizations that will perceive that they're in a very, very mature state, but actually when you look and start asking questions such as, how do you identify work stress measures, exposures, for example, quite a few won't really be doing much around that. So even if you just tackle the basic legal duty of care, that's where a good starting point to understand where you might sit in that sort of wider spectrum. But yeah, definitely, I think ideally we'd love to get to a place where there is a specific set of standards, and there are some great best practice out there. Thriving at Work standards, for example, which help organizations better understand where they should be sitting in terms of the mental health of the workforce, etc. But yeah, I think we've still got a long way to go to get to a place where we know what our starter for 10 is and what does good look like and what does excellent look like.
Yeah, I think it's something we notice on SHP in terms of the type of content that we get in that you look at something, for instance, working at height, and there's a lot of regulations in place there, and everybody's kind of in the same sort of ballpark in where they are in dealing with that. But well-being is such a vast difference largely on size of organisation, but not always in terms of the level they're at. So it's quite interesting, and it will something to continue to watch over the next couple of years.
And I think the key point there, I think with workplace well-being, it's so much driven by where you are as a business, where your people are at the moment. And whilst on the one hand, you've got the evidence base, and ideally you want to take an evidence-based approach, but on the other hand, you really want to understand the factors specific and unique to your business. Do you have people that work in isolation? Do you have issues around workplace bullying? Do you have factors around differences in line manager capabilities in terms of managing teams and steering teams, etc.? So all these, by better understanding those, that'll help that organization take a much more specific and bespoke approach to their business.
I guess now is as good a time as any for businesses to take stock about where they are. Obviously, so much has changed over the last 12, 18 months. Companies are going to start assessing where they are as a business in terms of flexible working moving forward, and actually in terms of their wellbeing program. Now is a great opportunity to go, look, this is where we are. This is what's happened over the last 12 months. We've hopefully spoken to our people and listened to what they've got to say, and we can address and rectify our wellbeing program accordingly to help us progress.
That's an interesting question to muse on will be the concept of, do we have a wellbeing program, or do we infuse good principles of wellbeing into what we do as a business? And I think in an ideal world, I would love us to be in the latter. Good wellbeing program historically has been a lot of tertiary focus. Let's provide helplines, let's provide insurances and support services for a point of need. Whereas in reality, the big ticket items are around how well are our people, how engaged are they in their work? Do they feel they can talk to their managers? Are they thriving in what they do? What are the barriers in place which are preventing them from thriving at work, et cetera, et cetera? And that's really what we want to focus on, whilst making sure we've got optimized support behind the scenes as well.
Right. There's a question here that you referenced in the talk. The study showed that many workers don't have time to complete their work. As an employer, how do you guard against employees pushing themselves too hard, especially when they're not working together under the same roof?
Yeah, it's a really good question. I mean, it will be subjective. It will be very individual to each individual person. The most common methods of doing that and understanding that would be things like stress risk assessments. So equipping managers to be able to sit down and better understand what are my thresholds for each of my team? Because as we all know, some people will thrive under pressure, but of course, it's the right amount of pressure to each individual person and making sure they've got the right resources, the right support around them, et cetera, et cetera. So things like a stress risk assessment. So the health and safety executive have a stress risk assessment template, which is a very, very good way in which you can facilitate a conversation, or look at the health and safety executive talking toolkit, a great resource for equipping managers with some of those basic skills around how can I have a conversation with Ian in my team to make sure that he's got the right amount of workload for him, he's got the right support, the right resources, good working relationship, etc., etc. So I know where Ian sort of sits in that theoretical stress response approach, and I know where his pressure points are, and I know what happens when Ian has too much work on, or if he doesn't have enough control over his work, if he's bored or whatever it might be, and then therefore I can then put in place measures as his manager to support.
Oh, interesting that you mentioned that. We actually had a talk from Jennifer Webster earlier this afternoon from the HSC talking about stress risk assessment. So if you did miss that, then please do go ahead and check that out on demand. You mentioned that you've got partners both in the UK and outside the UK. Have you noticed any differences in the way the pandemic has affected businesses in different regions as opposed in regard to wellbeing?
It's a difficult one for me to answer, Ian, because 95% of our clients will be in the UK. We have a small number of organisations, so it wouldn't be a representative sample. So I wouldn't feel it would be fair to answer the question specifically, Ian.
Okay, and do you work quite commonly with the construction sector, and obviously the construction sector has been at the forefront of tackling mental health in the workplace over the last few years. Can you just talk a little bit about how that's been achieved in construction?
Yeah, I think firstly, I'm incredibly proud to be part of, just a tiny part of what the construction industry has done, and makes in mind the work the charity has done, the work of other bodies as well, has been absolutely tremendous. If we look at where the construction industry was, say, 5 years ago compared to today, I think general mental health awareness levels have increased dramatically. I think it's much more common to be having the conversations about what's going on in here in construction than it was 5 years ago. That's not to say that they're at the end of the game and they've kind of won it, because there's still a tremendous way to go in the sector. But it's great to see general mental health awareness levels have really increased. We've seen some real shifts in supervisory and line management behaviours, which can often be one of the key drivers. I think one of the other big areas of which needs to be addressed within construction is looking at the client through supply chain, because of course, as we know, one of the biggest drivers of stress within construction will come from the project downwards, and that can drive through the whole supply chain. So that's an area that will need to be focused. We're now undertaking some in-depth research in partnership with BNCE and the Institute of Employment Studies, which is looking at a really critical area of mental health in construction, specifically focusing on sole traders and small businesses, which is looking to understand help-seeking behaviours, how we talk about emotional and mental health to better help us better understand, and of course also the prevalence of mental health disorders, diagnosed or undiagnosed within the sector, to help us better understand how can we develop more informed and robust interventions to support the small businesses within construction. So tremendous movement within construction.
And have you noticed from your clients any sort of common strands and threads of challenges over the last 12 months? Has it been isolation? Has it been people working remotely? What have you kind of heard from people that you're dealing with?
Yeah, and I would say this applies in all the sectors that we work in, and we're 95% construction, but a lot of our some of our other work will cover related industries as well. But the themes are all very similar, and they come down to increased work demands. We're seeing issues around isolation, and particularly isolation as a big issue. We're seeing issues around work engagement and buy-in and recognition from senior leadership. So not having share of voice. We're seeing some of the most common ones. But yeah, so and also a lot of themes relating to how do we do this differently. So the question about, I've referenced it in the talk we just went through about, we've got certain interventions in place at the moment, but we want to ultimately optimize our current approach. So we've got an EAP, but we have low engagement, low participation. So we're concerned that the right support's not getting to the right people at the right time. Or we've got psychological first aiders, whether it's mental health first aiders or other, and we're concerned about A, their welfare, and B, they're not actually being engaged with, for example. So we see a lot of sort of more specific intervention-based issues, as well as wider group level related issues down to work demands being probably the biggest one.
It's really interesting around isolation, isn't it? Because you mentioned some people have really thrived from the fact that they might have live with a group of friends or live with family, and that working from home has actually increased their ability to see people and be around friends and family and be able to go for walks in the local area. Whereas some people that live on their own, who rely on going to the office or the social aspect of after work, they rely on that to have for their social interaction. So it's really difficult, I guess, when managing those groups of people as you put together a flexible working program moving forward.
Yeah, probably one of the most common observations that I hear, again, this is just from my specific experience, will kind of relate back to that water cooler moment. We've lost that interaction, and actually we tend to see a lot of 9 to 5s becoming the 8 to 6. We're topping and tailing our work days. We're doing it. There's a lot more bureaucracy. There's a lot more meetings being scheduled, and we're not having those more basic, how you doing? The conversations that you and I might have on the way into the office or at the water cooler, or I'm just going to pop over the road to Tesco's and get a can of Diet Coke. Do you want to come with me? We're missing those interactions, which can't be underestimated.
Absolutely. Just finally, I've probably got time for one more. So it's just quite a quick one. I think we'll end. I think you've probably touched on it a little bit during the session, but what would you think people's takeaway should be from the session? What are your top kind of 3 tips for starting an effective wellbeing program?
I think good question. I think probably number one is look at what you've got. Look at what you've got in place at the moment, and look at what it's telling you, what it's not telling you. If you have nothing in place, then just talk to your workforce. If you've got 10 staff, 100 staff, 1,000 staff, talk to your workforce, or look at what already is in place. So start that journey by making sure what you do is based on an informed approach. Probably the most important thing I would say it would be the key takeaway. I think secondly, always remember help-seeking behaviors in the design of any program. You remember that people won't always reach out for help, so you've got to factor that in your design. So if you're going to put a helpline in place, think about the way in which people will actually engage with that. And probably the most effective communication channel will be your co-workers. So making sure you're upskilling people in basic principles of things like psychological first aid. So looking out for self, looking out for others, knowing how to signpost, recognizing your boundaries, probably the most important thing. And in fact, I would close probably on that last thing. And I was asked this question a few weeks ago, actually, what if you could only ever do one thing? Which of course it's completely nonsensical. You wouldn't only ever do just one thing. But if you only could do one thing to address wellbeing in your business, I would probably say equip everyone with a basic level of psychological first aid, which is this concept of it's okay to not be okay. Well, actually, in reality, it's not okay to not be okay. But importantly, it's critical that we look out for self, we look out for others, we know what support's in place. We're there to listen with empathy. We're there to signpost people to the right support services. We're there to recognize our boundaries. And we're there also to recognize that every single one of us is very, very unique. And what affects one person will affect someone else in a completely different way.
Perfect, Stephen. Really, really useful. Thank you very much for your time this afternoon. Some really interesting and insightful information to take over there. Thank you to your dog as well for staying quiet throughout the presentation. So I'll let you get away and take that out for a walk. Obviously, thank you very much for tuning in and listening and the engaging with the session. If you missed any part of it, as I said at the start, it is available on demand, as with all the sessions from the conference up until the end of July. Following immediately after this presentation, we've got an interactive workshop on building your own resilience workshop. So please do stay tuned for that. And when there are breaks in the content, please do be sure to check out the rest of the Connect platform, where you can browse exhibitor stands, see live product demos, and also see content from the other co-located shows, including Safety and Health Expo, FireX International, IFSEC International, Facility Show, and International Buildings Europe. My name is Ian Hart. Thank you very much for joining the session, and enjoy the rest of the conference. Stephen, thank you very much.
Thank you.